What is standard of care in CF clinical trials? Have you ever wondered what the term standard of care means in the context of cystic fibrosis clinical trials? In the world of cystic fibrosis, or CF, the standard of care refers to the best practices and approved therapies currently used to manage the condition and support patients' health. This includes well-established treatments such as airway clearance techniques, nutritional support, and both chronic and acute antibiotic therapies. Additionally, there are CFTR modulator drugs that specifically target the underlying genetic defect in cystic fibrosis. These treatments have been thoroughly validated through extensive research and are widely accepted by the medical community as effective management strategies for CF. In clinical trials, the standard of care acts as a baseline against which new therapies are tested. Since effective treatments already exist, trial designs often compare new interventions to these established therapies instead of to a placebo. This approach raises important ethical considerations because withholding effective treatments from participants is generally avoided. Consequently, many CF clinical trials use active comparators, meaning that the new treatment is tested against the current standard of care rather than no treatment at all. This method helps to demonstrate either superiority or non-inferiority of the new therapy. The evolving nature of cystic fibrosis care, with ongoing improvements and additions to standard treatments, presents challenges in designing clinical trials. Researchers must consider how to incorporate these changes to ensure that trials remain as relevant and ethical. For instance, as CFTR modulators have become standard for many patients, trials testing new modulators or alternative therapies must account for patients who are already receiving these drugs. This can complicate trial logistics, including blinding and measuring outcomes. Standards of care in CF clinical trials are informed by comprehensive clinical guidelines developed by expert panels and organizations such as the Cystic Fibrosis Foundation and the European Cystic Fibrosis Society. These guidelines synthesize the latest scientific evidence and expert consensus to recommend best practices for managing cystic fibrosis across all ages. They emphasize the importance of multidisciplinary care teams, individualized treatment plans, and ongoing monitoring to optimize health outcomes for patients. In summary, the standard of care in cystic fibrosis clinical trials is the current, evidence-based set of treatments and management strategies accepted in clinical practice. Trials must ethically and scientifically compare new interventions to these standards, ensuring that participants continue to receive effective care while advancing knowledge and treatment options for cystic fibrosis. If you are considering participating in a clinical trial, it is always best to consult with your healthcare professional to understand how these trials may impact your treatment journey.